My name is Wolfgang Schaller.
And how did you find out about Dr. Leong?
I found out about Dr. Leong through a magazine, a health magazine I found at the doctor's office. And I read the articles in it, and it intrigued me. I've checked up on it 3 or 4 times before I made a decision to come here, and I decided come here. I had other interviews, but I didn't like what I heard, so I wound up with you, and I'm glad I did.
What was the difference? Why did you decide to come here?
Because I thought other people told me different stories, other doctors, dentists, that they could do other things that I found out later on, as far as my interview was concerned with you, that wouldn't have been right to do in the first place. So I am very glad that I came here.
How would you describe your condition when you first came to this office?
My condition was pretty bad. I haven't eaten anything solid for about 3-4 months, maybe longer than that. It was always soups and liquid stuff and very soft stuff because I couldn't bite anything. My dentures would flop around in my mouth and wouldn't stay in, even though I put polycrip in there and whatever. I would go through a tube of polycrip about every 3 days. So it was a bad situation. The dentures were very bad. I really couldn't bite anymore, so it was time to get something done about it.
There was something about your jawbone that kept you from being able to eat correctly. What was your assessment of your jawbone?
Well, my jawbone, which I found out, I suspected that I had a big reduction in my jawbone and gum, because my dentures, just wouldn't hold anymore. So I knew I didn't have much bone left, especially on the bottom. And that's why I was surprised that some of the other people said they could put teeth in there, and I found out later on there was not enough bone to do anything with from you. And that made me very happy that I came to you. But my bones are 80% gone, I guess. There's not much left. So the procedure that you've been using was the right thing to do.
So would you describe what treatment you went through in order to bring you to your present condition?
Well, we had 3 or 4 examinations and evaluations beforehand, and it was finally decided that I should have an implant on my lower jaw. And an implant that would be a lot different from other implants that would hold a denture on my bottom jaw that would be solid and I could bite on, and make my my smile better, and have new upper dentures that would keep my jaws quite a bit further apart from what they were before. So that was the main thing. It made me look better in my face structure and my lip structure, and so that was an important thing to me, and I liked very much how it all came out.
Would you describe how you felt about the surgical procedure? Did it bother you a lot? Do you remember much about it?
I thought the surgical procedure was very, very good. I was semi-conscious, and nothing hurt. It was, as far as I'm concerned, it was beautiful. It lasted for 2 or 3 hours, and it came out very well, and I had no problems at all. After the surgery, no pain or anything else that I can speak of. So as far as I'm concerned, it went very well.
And how do you feel about your mouth now?
Oh, my mouth, I can eat steak again, and I can bite into apples, and I can eat regular food. And my lower dentures are solid, like regular teeth. I have no problems with those. My upper dentures fit very well. So I can eat just about anything I want to now.
Would you recommend other patients coming to see Dr. Leong?
I sure would. As a matter of fact, I did already with some people. I don't know whether they came here yet or not, but anybody that talks to me about dentists, Dr. Leong is the one I recommend.
Well, thank you very much.
You're welcome.